Droperidol is a dopamine antagonist. We are going to be giving this for patients who have nausea, for our violent combative patients, for patients with gastroparesis, that's slow emptying of the stomach, and marijuana-mediated abdominal pain, along with any type of vomiting. So how does droperidol work? Well, it's used to prevent, treat postoperative nausea and vomiting. It's used to maintain a patient in a calm state with indifference to surroundings. This is that violent or combative patient we're talking about. It's going to produce a marked tranquilizing effect and sedation. If you're getting into the weeds, it's going to cause a CNS depression at the subcortical levels of the brain, midbrain, brainstem reticular formation. That is how it's causing that tranquilizing effect with that sedation in that combative patient. The onset for this is 3 to 10 minutes. So the nice thing about it is, if we're giving our first line drug as Zofran and it's not working for that nausea and vomiting patient, you're going to give droperidol, and within 3 to 10 minutes, hopefully they've stopped vomiting for you. So once again, the indications, like we said, that violent combative patients who the hospitals are seeing right now is a lot of marijuana-induced abdominal pain with vomiting who are not responsive to our typical drugs. The only contraindications are going to be allergies. You need to make sure you put these patients on the EKG and looking for that prolonged QT interval. Droperidol is going to be contraindicated in that. Some of the side effects is we're going to have a decrease of your peripheral vascular resistance, so you can have some hypotension effect. So our dosages. If we have a nauseous patient, we can do 0.625 milligrams all the way up to 1.25 milligrams, and this can be given IM, IO, or IV. If you need to, for that nausea patient, you can repeat times 1. If you have that violent, combative, or agitated patient, you can actually do 2.5 milligrams, and once again, IM, IO, or IV, and you can repeat that times 1. Remember, look at your protocols. This is going to be under M10 or M11, medical 10 or medical 11.